we're talking about CPR for children. CPR is a skill that every parent and family member must have. CPR is not about bringing somebody to life. It's about circulating blood and therefore oxygen around the body, primarily to the brain, so that if the cause of the baby or child going into cardiac arrest can be fixed, you have given them the best chance possible at a good outcome. We're going to go through the steps of doctors A, B, C, D. D for danger, R for response, S for sending for help, A for airway, B for breathing, C for compressions, and D for defibrillator. We're going to go through each step in detail and then put it all together and show you at the end. D is for danger. You need to ensure that both you are safe, your child is safe, and those around you are safe. You need to think about things like electricity, fire, roads, water, what dangers are around you and your child. Even though it can be very tempting that if your child is injured to run straight to them, it's every parent's instinct to do that. You need to take that split second to make sure that you are okay, because if you are injured while you're helping your child, you can't help them and they need you. So look around, make sure your surroundings are safe. And if your child is safe where they are, leave them where they are as you go on through the rest of doctors A, B, C, D. However, if their life is in danger where they are, then you must carefully move them no matter what their injuries are. R is for response. We want to see if your child or baby is conscious or unconscious. Because if they are conscious, they do not need CPR. Squeeze them on their shoulders, open your eyes, give them a good tickle, open your eyes, can you hear me? Open your eyes. And hopefully they are giving us a nice big cry, or they're pushing us away. If they are unresponsive, if they are floppy and not responding to us, we move on to the next step. S is sending for help. You need to call emergency services. In Australia, the number is 000. In New Zealand, 111. Make sure that you are familiar with the number to call an ambulance in your country. In Australia, what we encourage you to do is download the Emergency Plus app. You can dial 000 through the app by simply pressing the button, and it will give the operator the latitude and longitude of where you are. Because often, even though, we think we always know where we are, what happens if you're at a friend's house? You know what suburb they're in, but maybe not the exact address. Maybe you're at the park. Maybe you're out bushwalking somewhere. Being able to give the operator the latitude and longitude of where you are is so important so emergency services can find you quickly. The important thing to remember when you're speaking to the operator is to answer their questions. Tell them where you are and what is wrong very, very clearly, and don't hang up. They will be sending an ambulance to you while they keep you on the line, instruct you what to do, and ask you questions as needed. Make sure that if there is somebody with you, you send them outside to wait for the ambulance and bring them in. Ensure that pets are locked outside if possible, and ensure that the front door is unlocked and the paramedics can get to you and your child. If you don't have your phone with you, get help any way that you can. Shout until the neighbours hear you, bang on doors, flag down a car, do whatever you need to do to get help, but don't delay giving CPR. A is for airway. We need to clear and open the airway. Your airway is the tube that goes from your nose and mouth down into your lungs, called the windpipe or the trachea. And in adults, It's quite large in diameter and quite firm, a bit like a garden hose. But when it comes to babies and children, the airway is really quite soft and floppy. So in a baby, if you imagine, it's more like a plastic straw. In a child, it's a little bit bigger, but still quite floppy and quite narrow. So we need to remember that babies and children can block their airways very easily. When we are unconscious, our airway loses its protection. All of our reflexes and muscles that keep it open are no longer there. Their head will flop forward and their airway will kink off like a straw. So we need to come along and open it. We're going to look in their mouth. If they have carrots or vomit or Lego, something in there, what we're going to do is roll them onto their side and we can clear the front of their mouth. Let that drain out. We're not doing any big finger sweeps right to the back because we may push that object further down. Once clear, roll them back onto their back. We are going to do a head tilt, chin lift. We're going to gently pull their head back until their chin points towards the ceiling. We are going to hold them along that hard line of their jaw and lift their jaw upwards towards the ceiling. This is called a head tilt and chin lift. And what it does is it puts the airway in the right position and it pulls the tongue forward so it doesn't obstruct the airway. B is for breathing. We need to check for normal or abnormal breathing. The way we do this in a child is continue to hold their airway open. Get down nice and close and we're going to look, listen and feel. We're looking for rise and fall of the chest or tummy, listening for air coming out and feeling with our cheeks. And we do this for up to 10 seconds. We're not looking for a complete absence of breathing. They may be taking funny gasps. Their breathing may be quite shallow. You may see no breathing at all. Trust me, you will know if their breathing is abnormal because you know what is normal for your child. C is for compressions. If your child is unconscious with abnormal or no breathing, we need to start CPR. We don't check for a pulse because it's not about a heart that has stopped beating, it's about a heart that is ineffectively beating. So how do we do compressions in a child? First of all, we need to do compressions and breaths. 30 compressions to 2 breaths. In a child, we are going to use 1 or 2 hands. Whatever you need to use to achieve a compression of 1/3 of the depth of the chest, because that's how hard we need to press. Feel on yourself. Can you feel that hard breastbone or sternum? We want to aim for the center of the chest. If it's squishy, you're on stomach. That's too low. Make sure that you can feel that hard breastbone under your hand. So, on that hard breastbone, in the center of the chest, with 1 or 2 hands, we are going to press down 1/3 the depth of the chest at a rate of 100 to 120 compressions per minute. That's almost to a second. And the songs Stayin' Alive by the Bee Gees or Baby Shark, do, are 2 perfect songs for you to compress to the rhythm of. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You'll note when I do my compressions that I let the chest come all the way up without taking my hand off and then compressing down 1/3 again. This gives a good, high quality compression. It allows the heart to fill up with blood, then we squirt it out again. Fill up with blood, squirt it out again, to circulate the blood around the body. To do the breaths in a child, you need to open up their airway, pinch their nose, and with your mouth, put a good seal over their mouth and inflate their lungs. 1, 2. You'll note that I took my mouth off in between those breaths to allow the air to come out. It depends on the size of the child as to how much air you're going to put in. You shouldn't be struggling for breath and turning blue and forcing air in. All you need to do is enough to simply see the chest rise. Once we've done our 2 breaths, we move straight back into compressions. If you think that your breaths haven't worked, don't waste time doing more. It is simply 2 quick attempts at breath and then straight back into the compressions. Because remember, if we're wasting time on perfecting our breaths, we are not on their chest pumping that blood around the body. If there is more than one person available, one person continues on with a CPR, another person goes and gets the defibrillator. First thing you need to do is turn the defibrillator on and listen to it.
Remove pads from package and apply to patient's bare chest. Apply pads to patient's bare chest. Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Charging.
Listen to what it tells you to
Stay
do.
clear of the patient. Deliver shock now. Shock delivered. It is safe to touch the patient.
And continue on with CPR.
Start CPR.
First of all, check for danger. Make sure that you are safe, they are safe, and those around you are safe. Next, check for response. Open your eyes, open your eyes, open your eyes. We want to see if they are conscious or unconscious. If they are unconscious, we move on to the next step. S is sending for help. You need to call emergency services immediately. Call for an ambulance to come and assist you. Don't hang up, stay on the phone, be calm and follow their directions. Next, clear and open the airway. In a child, we're going to do a head tilt and chin lift. But first, look in their mouth. If they have vomit or other objects, gently roll them on their side, let that drain out or clear from the front of the mouth. No big finger sweeps. Roll them back, tilt their head back and lift their chin towards the ceiling. Keep holding their airway open. Next, check for breathing. We are going to look, listen and feel. Get down nice and close, look for rise and fall of the chest or tummy. Listen for air coming out and feel with your cheeks. We're not looking for a complete absence of breathing. If their breathing is abnormal, if they are gasping or taking shallow breaths, or if there is no breathing at all and they are unconscious, we need to commence CPR. C is for compressions. Do not check for a pulse. It's not about a heart that's stopped, it's about a heart that is beating ineffectively. To do compressions in a child, 1 or 2 hands over the centre of their chest on the hard breastbone. Push down 1/3 the depth of their chest at a rate of 100 to to 120 compressions per minute. That's almost 2 a second. We're going to do a ratio of 30 compressions to 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Open up the airway. Breathe. Breathe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Open up the airway. 1, 2. If there is a defibrillator available, use it. If you are by yourself, continue on with CPR only. If there is another person available, send them to go and get the defibrillator and follow its prompts. You do not need to be trained to use it. And when do you stop CPR? If the child starts responding. If you are too physically exhausted to keep going or you're in danger. If somebody more experienced comes along, such as the paramedics arrive, or the defibrillator tells you to